Good afternoon. This is a standing committee on health and social development. Today is Wednesday, June 9th, 2021, and we're excited about this meeting. Before I get started, I want to wish a constituent a very happy birthday today, Marcia Beck. Happy birthday, and I hope you're having a great day. And with that being said, can I get an adoption of the agenda? Okay, Zach Bell. I'd like to welcome the members here today. We have Zach Bell, Carla Bernard, Michelle Beaton, Rob Henderson, and Corey Deagle. So today we're going to receive a presentation from the Charlottetown Professional Firefighters Association on the topic of resources and training in the current response model. So what I'll do is I'll pass it over to our guests and they can introduce themselves for Hansard and then carry on with your presentation. And then if you'd like, we might wait to the end to ask some questions and yeah, just feel comfortable. So I'll pass it over to our guests.
Sure.
Great.
I'm Spencer Waite. I'm the president of the Charlottetown Professional Firefighters Association, IFF Local 5219. I'd like to say good afternoon to each and every one of you. I met a lot of you throughout the years. Of course, Chair Gord, Mr. Bell, Ms. Bernard, Ms. Beaton, Mr. Deagle, and Mr. Henderson at the back. Today we're going to talk about our fire service delivery, but before I get into it, I'll introduce my vice president behind me, who is Allan Tilley, and my secretary, James Pickard. All three of us are career firefighters within the city of Charlottetown. All of us started our career as volunteers. I've been into it for 20 years. I think, Allan, you're 25, and James around 10. Charlottetown is a composite fire department made up of both career and volunteer personnel. I think it's important for us to know where we came from so that we've sat in every seat around the table within the fire department. So a lot of the benefits that we learned as volunteers and giving back to our community, we haven't lost that. That's why we're in the job that we're in. And I will get into it more, kind of the structure of the department in a minute. I think what I'd like to do first is obviously say how proud we are to and humbled we are to look after the city of Charlottetown. We take it as it's just such a privilege to be able to do it. And in every aspect of it. Today we do rescue cats. We do actually do that, but also it becomes much more intense than that, and we'll go through some of our responsibilities. Who the Charlottetown Professional Firefighters Association is, we are the union representing PEI's only career firefighters. Just to kind of elaborate a little bit on that and clarify, somebody might say, well, I thought I seen a guy wearing a uniform in Summerside. And that's true. In Summerside, they have somebody, he's a dedicated dispatcher / cleaner. And in regards to his roles, my understanding is that if there is a fire, that individual may take a fire apparatus or a truck to a scene. But still, his position is not a career firefighter. According to their collective agreement. Also, we have some folks at the Charlottetown Airport Authority. Those folks are cross-trained. They could be in maintenance, but they're also cross-trained in aircraft firefighting. So those folks do not fall under us. Our folks are strictly under the Charlottetown Fire Department. And we are an affiliate of the International Association of Firefighters. So that would be kind of like our parent union. All of our communications, our education and resources come from that division. And we belong to what's called the 15th District, which includes most career firefighters from Montreal East. So the locals start, and when I say locals, our group, we're around 20 folks, just shy of that, but we have groups that may only have a half a dozen firefighters, right up to somewhere like Montreal that may be closer to 2,000. So we have a vast experience regionally just to call upon within the Maritimes and Atlantic Canada and beyond. They represent the IFF, over 300,000 career firefighters and paramedics with 3,500 affiliates or locals. And we protect 85% of Canadian US population. And the IFF belongs to most boards of education, accreditation, codes, protocols for fire service. So we're involved in every advancement in the fire service. And we have headquarters in Ottawa and in Washington. Our membership, like I said, is under 20. We have 8 firefighters full-time, 2 fire inspectors, and 1 fire prevention officer. So for firefighters, we're into the suppression of things, obviously firefighting duties, medical response, and I'll talk about that. Our fire inspectors, they enforce code, inspect our various occupancies across the city to determine that they're within fire guidelines and protocols. And our fire prevention officer looks after education within the city, going around to our schools, long-term care facilities. A business calls and needs a little brush up on extinguisher use. She's going to be there to assist. Then also we have 6 part-time folk. They give us 3 and the other full-time firefighters our vacation and illness relief. They also are volunteers as well, so their skills are kept up, because if they're not reporting as part-time firefighters, they're still in the force as volunteers. Some of our responsibilities, just aside from everything that's listed here, just a smaller list. We're kind of a catch-all. Firefighters in every community, if the police can't deal with it, paramedics can't deal with it, it doesn't really matter what it is. And I joke about the cat in the tree, but it does happen. Other animals in distress, that type of thing, that does fall under our jurisdiction, and also anything in our water. So there's things that are outside of fire. Everybody assumes that it's fire, but we go to hazardous materials calls. Could be a propane leak. I know Allan, we were commenting on one on the way here. He responded to one with 17,000 liters by himself that flowed from our bulk station on Allan Street. So, and also we assist our neighboring departments like elders do, mutual aid agreements. The inspectors and the prevention division, they're doing education, visiting occupancies, restaurants, hotels, schools, making sure that they are having the safest establishment possible. We obviously maintain our own equipment to the best of our abilities. If it goes beyond our skill set, it's sent out to a third party. But we do have to take additional training and that type of thing over and above our fire training to maintain those things, and do annual service testing on hose. We provide medical care, obviously across the province. Many fire departments do. Charlottetown, we're at a tier 3, and what that means is provincial firefighters, the department actually determines what level of care they're going to give. So maybe in Tignish, they would provide a different level of care because there's distance there from them to the ambulance service. Whereas for Charlottetown, we respond only when requested. So that would be like a tier 3. 4 being significant delays, going up to 2, that would be specific illness, and 1 would be almost reporting to anything, what the ambulance would call a code 1. Our stations, we have 2. We have one in Kent Street, that's where the 3 of us work out of, and Station 2, which is located on St. Peter's Road, formerly known as Sherwood, prior to amalgamation. Station 1 is what we would call a combination or a composite department, where you have career and volunteer. and Station 2 is strictly volunteer. You've also heard lots of talk about a third station that's currently under review. And I'd like to talk about the third station just a little bit when we're here. The station right now is been allocated about $4.5 million. We all know the cost of materials today. $4.5 million is not probably significant enough to build a station in a municipality of this size. However, that's how the city's gone about it. Versus looking at the needs, who's going to be using that station, what pieces of equipment are going to be in it, and building backwards towards a dollar amount. They've actually started the process backwards themselves in setting a dollar amount and trying to make it work. Through a project management lens, that's probably irresponsible, because we have no idea as staff personnel what our role is going to play within that station. Kind of another important point along Station 3 is that we as career firefighters and the IFF, with all the resources that we haven't had the opportunity, haven't been asked to provide input in what we'd like to see. And we can help in so many ways because we have people from all walks of life and all these resources to draw on. IFF has folks that specialize strictly in station development, and it has not been tapped into. And our city leaders are well aware of that. However, our main concerns are working alone and the service levels within the city of Charlottetown. You'll see on these dates, or these days, Monday through Friday, 4 to midnight, we work alone, and then again Sunday all day through midnight again. So the only time that you can guarantee that there's 3 folks there is between the hours of midnight and 8 a.m. in the morning. And then Monday through Friday, 8 in the morning till 4 p.m. So it leaves about 72 hours every week that the fire department only has 1 person there. Now, you might say, well, you do have volunteers. You're right, we do, and they're the best, and they're so dedicated. But the problem is the delays we have in getting them to the scene. Not unlike everyone else in this room that has a career outside of fire service, it takes you a while to get up out of your seat and get to the firehouse. Place of work in the wintertime, obviously you got to scrape your windows. So there's delays there. Whereas when a career firefighter goes to your door, they're ready, they're out the door within 1 minute. Excuse me. The other problem is that there's 2 levels of service. So in our city, we all pay the municipal same tax rate. We all have the same municipal services, we assume. That said, that's not really the case. So if we look at Station 1 that does have career and volunteer personnel, that's great. That 1 person, 1 to 3 people I should say, are going to be attending right away with the volunteers quickly coming behind them. Station 2 do an amazing job. They're strictly volunteer. They don't have that same service. So just to put this into perspective, somebody that lives in Brighton is going to have a firefighter at their door probably within 2 to 3 minutes. Somebody that lives in a subdivision, say outside the city core, maybe Lower Malpeck Road, which we also protect, subdivisions off there, Malpeck Road, in the industrial park, a high hazard location. It could take upwards of 15 minutes or longer to see a fire truck at your door. And we'll talk about why that's important. I mean, I think it goes without saying. So just to touch on the staffing, the minimum safety standard that we go by through training and the standards that are out there, the rule of thumb is 2 in, 2 out. Simply stated, if James and I are in a fire together, there's no volunteers yet there, or there is, it really doesn't matter. Allan and somebody else should be there backing us up. Because if we're in there helping somebody and we run into trouble, we need them there to help us. It's not uncommon for firefighters to get themselves into a jam. We're actually really good at it. So that being said, right now when we have one firefighter attending, we have frantic public on the sidewalk, fire, car accident, medical emergency, a high-angle rescue. Whoever's there, bystander, or the person that's involved directly is frantic. Their family's frantic. Please help. We've been there. And they're asking us, and I said, I can't help you yet. I'm here alone. I'm very limited to what I can do. So at that point, we wait for incoming volunteers or these folks that are on call to come back us up. It's an awful position to be in, and it's an awful position for the public to be in. And I know you're saying, well, this happens elsewhere. Yeah, and it does. And we'll talk about the differences between us and some of those rural areas. Adequate personnel is key to preventing firefighter and civilian injury or death. Fire can spread beyond the room of origin within 10 minutes. I think it's important to say that our current structure, that 10 minutes, because you have to go through dispatch and those things, so the 911 caller, the fire's already on the go probably by that time, right, or whatever emergency that it is. 10 minutes is going to be here and gone relatively quick. So the time of origin is not when the fire truck arrives, as we know. It's also important to note that home furnishings and contents and the materials that our homes are built out of today compared to say 50 years ago are so much different. Everything's now made of synthetics and resins, and all those things burn so quickly and they're so toxic. And that's why as firefighters we stress the importance of wearing proper protective equipment. A fire compared to 50 years ago has been measured by Underwriters Laboratories at 8 times faster than it was 50 years ago. And of course, we're talking about heavy timber too in homes then, and now we know what our homes are made out of. More plastics than ever. The underwriters we've had third parties commissioned by the city that have studied our department over the years. Each and every study has recommended that we hire more. Now, it is amazing that we've saw 40 years, I know of 40 years for sure, that we've had studies done, and we've had 2 firefighters. 2 firefighters hired since 1973 in our career ranks. That said, the most recent study done by underwriters has not been released to us. We've requested numerous times, we've gone through FOIP, and it has not been produced because the MGA, they have protection, claiming that that report was before the Freedom of Information Act came into play for municipalities. And just to go back to the 2 in, 2 out for a moment, most departments are striving beyond that now. They're going with a 3 deep model, and a 3 deep model is that yes, you do have crews inside, you have crews on deck ready to go outside, similar to what this states, but you have another crew ready to go in reserve. And that our job, when we're doing what we do, it's extremely exhausting, and that relief that you get when somebody is fresh and ready to take over and let you go to rehab to get better, whether you're able to go back in again is determined by the emergency, but that break is so crucial. The service levels I mentioned, so we all pay the same tax rate, and we talked about this, the importance from, say, Brighton or a subdivision out Lower Malpeck Road. But just so you know what turnout time is, turnout time measures the time elapsed from when the emergency dispatch informs us and then when we actually leave the department. So we also call that the shoot time. Our shoot time in District 1 or Station 1 on Kent Street is 1 minute. At District 2, it's approximately 5 minutes. I know this. We were there, we worked there, we work alongside those fine folks. We are all one department. 5 minutes doesn't seem like a long time, but when we're talking about those delays of the point of origin of an emergency, takes them 15 minutes to get to those outskirt communities. The fire's been well going before we got the call. You know, what's the likelihood of life rescue if somebody is in a residence or a place of work? We don't like to know those outcomes, right? But like I say, even 5 minutes, and you folks come from all walks of life and in various communities, and our volunteers dedicate so much time. 5 minutes is a very respectful time. You know, there's nothing wrong with the time. They're doing the best they can with what they have. That said, in Charlottetown, some of the most dangerous and highly occupied spaces are protected by that station, District 2. The hospital, the industrial park, the biocommons, all these places where there's laboratories and manufacturing facilities with great risk to spread, to risk to life and property. We're there, we're ready to go. You know, it's amazing because we hear these calls in these outskirts. And if James and I and Allan are sitting at Station 1, ready to go, because we don't fall within those boundary lines, we won't go. So we sit at the station and see the timer tick by. Calls going to the hospital, calls to West Royalty, East Royalty, and we watch it. And we see those times. It's nobody's fault of the firefighters. They're doing what they can in those areas. But maybe the structure's not right. Maybe if you have available personnel at another station, maybe they should be attending those calls in assistance with those stations. As all one department, let's all go. And that's why we talk about a third station. Maybe there's so much that could be corrected or updated within our current structure before even looking at a third station. Touch on our call volumes. Our call volumes alone in 10 years, and this is published on our website, the city's website, there's been an increase of almost 70% over the last 10 years. Now, I haven't updated this because COVID years, it's really impacted our call volume in different ways because we've changed our way that we respond. Island EMS is not calling us as frequently because of the protocols to keep us safe along with the public. So there's many things that impacted us, and we did see a lull over when everybody was home, and that's just, you know, we did see an increase in kitchen fires because more people were home, but we did see a decrease in the business community because those facilities were not occupied as much. Since amalgamation in 1995, where we swallowed the royalties, Winslow, Parkdale, Sherwood, there has been hundreds of unionized folks hired in public works, parks and rec, water and sewer. Police, they've more than tripled. In the early 90s, there were around 20 officers on the street. Now they're up to 65. As for us, like I said, we gained 2 firefighters since 1973, and that happened in 2008, not to confuse things. And we had 1 fire inspector hired in 2013, and that's been a real benefit. Our population, well, it's increased 25% in the last 15 years. And it's no surprise we have thousands of people, families that are in the queue waiting to become newcomers of Canada from wherever, and that is only going to impact this and the work that we do. something here, I want to talk about how we're already behind the 8 ball in Charlottetown. We have amazing dispatchers. We're so thankful for them. They're the unsung heroes. They get us to where we need to be. Plus, they have the public on the phone all the while and trying to help them through whatever they're going through. And the problem is, it's hard to believe that our rural communities are actually ahead of us in this respect. There's one less step in a rural community when you're a 911 caller and have an emergency. You pick up the phone, you call, you get Medicom Atlantic associated with Island EMS. That call is then transferred to the agency that is actually going to respond to that emergency. In Charlottetown, there's an extra step in there. 911 caller goes to Medicom Atlantic because they take every single 911 call. Then, after they realize what agency it's going to, then they transfer it. If it's not their own Island EMS, then it goes to police dispatch in the city of Charlottetown, and Summerside does the same. So then, it finally comes to the fire department. So we have all these things stacked up behind us. You know, we already have the emergency that's ongoing. We're already understaffed. When the caller calls, they have to speak to 2 individuals before they finally get through to who's going to help them. So there's major delays here. This slide here is probably the most tragic. Charlottetown has a tragic fatality rate. This map identifies 25 locations of fire fatalities from 1982 till now. It does not include medical emergencies. So if we go on a medical first responder call, we're there with or before Island EMS, and that person, we lose that person, we can't help them. We wouldn't find out about that till after the hospital reports it anyway, so it's not going to fall into this category. These are strictly fire fatalities. Now, it's kind of hard to see there, but each location is color-coded according to the number of career firefighters that are on duty. But if we take that color coding either right away, in the last paragraph that you'll see, it says, the majority of fatal fires occurred with less than 2 firefighters that were on duty, and all occurred within fewer than 4 firefighters on duty. And I think that's important because that's going back to the 2 in, 2 out. I'll tell you, the majority of them, if you could see the color coding, is when 1 firefighter responded, fewer than 2. It is absolutely terrifying for us to go to these. We live with them every day of our lives. However, we wouldn't change what we do. We are so humbled, as I said before, to do this job. But it is so terrifying for our public to them to be begging for help and we can't provide it, because that's what we want to do. I want to bring up Allan behind me. Allan's had a pretty tough career. Allan's just getting back after over a year off work. Allan went to a fatal fire, responded alone, watched a man burn to death before others could assist him. Thankfully, police were there, Island EMS came, and our courageous volunteers were quick to respond. But what Allan beats his head up against the wall, and I want to ask you to speak about it, Allan, I know it. What keeps him up at night is what could have happened if there was 4 people on that truck. Prior to that call, only years before, we had an officer perish in a fire in Charlottetown on his own time. He wasn't on duty. He too responded to that call alone. That man died. Talked about it earlier. Allan responded to a gas leak, propane, 17,000 liters. There's reports of many people that have perished to propane leak because of ignition. Thankfully, that's what we did not have. With a lot less propane than that. That's an extreme amount. That is a major leak. I'd like to show you the boundary lines, but it's just too hard there. But you can see the core. The core of the fatalities are the downtown core, and that goes without saying. I mean, that's where the density is. That's where the population is. That's where you see your older structures and those tight-knit streets. But you can see them stretching out there as well. And that second area that you see in the top left corner of the image, those are some District 2 fatalities. And I'll mention that because of amalgamation, we don't necessarily believe that we have all the records accurate for that district, because they didn't become part of Charlottetown's record keeping until the mid-90s. Now, how do we compare to other communities? And I'm going to go outside PEI because we are the only career member, so I'm going to pick on some of the communities that closest compare to us. And I didn't include Moncton, I didn't include Halifax, we didn't include St. John's, Newfoundland, nor St. John, New Brunswick. We're talking about communities that have roughly 20,000+ more, obviously Halifax a lot more than that, and St. John's, than we are. So they're not fair to compare to. But we look at Fredericton at 58,000. Charlottetown was compared to Fredericton for a long time, and then their population sneaked up, and then the municipality began kind of stop talking about Fredericton. But Fredericton has no volunteers. They work with about 100 full-timers, and they have 17 on duty at all times. And then there's us with 8 full-time firefighters and 1 to 3 on duty. And you can see these populations, and I didn't bother posting the areas nor the density because we're very comparable. We fall right within the average of all these folks. But you know, you start trickling down, and you get down to somewhere like Oromocto, and you're saying they got 9,000 people. They got 16 career firefighters. They also have volunteers. They have a second station of volunteers, much like Charlottetown, but they always have 5 career people on hand. And all it does is we help each other. The career guys get there first to mitigate things right off the get-go. The volunteers are filing in as they can, as safely and as fast as they can. It's a great team effort. But there's a breakdown within the structure. We're not going to all those emergencies. And really, it's unfair to somebody who lives in Winslow versus Brighton, who's paying the same tax rate, to not get the same level of service. It's absurd. Other communities that I didn't list are places like Yarmouth. Amherst across the bridge. Amherst, Nova Scotia has 2 people on deck all the time. Full-time career firefighters all the time on top of their volunteers. So they're operating to be arguably more safely than we are, right? Yarmouth, Stephenville, Newfoundland, I think they have a population, anyway, those are populations below 9,000. They all have 2 firefighter minimums. But because we live in PEI, I think it's kind of important to bring up the topic. Why are we different than, say, Tignish or North Rustico? These guys are fighting the same fires. It's true, and we're fighting the same situation right here in our own city. One, we all have a responsibility to protect the capital city. It's birthplace confederation. We have the highest population and density. Our population jumps significantly during the summer months, and we've heard it. And I know that the Charlottetown Tourism Department has heard it, that your fire protection, it's not really up to snuff. So people may evaluate coming to Charlottetown based on the fact that they may not feel safe. Strictly our call volume. Our call volume is so much more significant. You know, your rural departments are running anywhere from 25 to 100 calls a year. Very significant when you're in the field working and you have to run out or get out of the tractor and run and make that 15 minutes. And that's why you probably see some of those structures, you know, you have devastating results. What sets us up a little bit different? Well, we're there, we're getting paid to be there, so there is responsibilities that we're going to be doing. We're going to be going to these occupancies and businesses around town, enforcing code. There's a level of education that we have to have that volunteers don't necessarily need to have. Lots of them do probably, but we need to have it in order to get hired. So we have to hold a seal no different than any tradesperson. That differs from our world counterparts. We protect more high hazards. I already talked about labs, hospitals, schools. Well, everybody has schools. Well, you definitely, you know, in those other communities, they don't have as many schools. They don't have the bulk storage of gasoline and oil at their waterfront. Government offices, places like this, our province house, Veterans Affairs, all these places that are large and largely occupied through business days. Our accommodations, the bulk of accommodations are here in our city. We have the most retail, and our places of assemblies are more greater, churches, rinks, etc. I want to talk about a few more things that aren't on the slide, but thank you very much for listening to us. I know one of the questions that you folks are going to have, well, what can we do? That's a municipal problem. Well, I've heard it a lot. And I agree to a certain level, but I see some of the folks in here represent Charlottetown constituents. I see the responsibility of this city that has for the entire province, being a capital. And the municipalities have their own autonomy, and it's given to them by the province. However, the province still holds the big stick. They have authority, they do have jurisdiction. This is a problem that has been brought to every level of leadership within the city of Charlottetown, and nothing changes. This is a safety concern. We all deserve to be able to go to work and be safe. You folks deserve the same service in your homes to be safe and be protected within reason. I know that. And when I say within reason, it has to be done being fiscally responsible. Well, the city of Charlottetown is very vibrant. The city has boasted 2 surpluses over the last 2 COVID years. Something like that is something else. That is amazing when we look across Atlantic Canada. Not too many communities can say that. Most are suffering. 3.4 million this year, 9 million last year, and last year they mentioned that they saved $2 million in protective services. Well, that same year we had a death. It's not something to be proud of, boasting about protective services saving money when you have a death in your community. Maybe it's, you know, we're not necessarily here asking for funding. We're looking for your assistance. We're looking for your influence. We want the city simply to follow the recommendations that have been given to them by the experts and the professionals that they have acquired to study their city, our city. And maybe in regards to dollars, maybe more tax reform is required in the city. You know, everybody's priorities are a little bit different, I know, whether it's beautification or what have you. But our argument is, what is more important than the safety of the people that we protect and live here? You know, it's really, there should be nothing. So with that, thanks again. If you have any questions, please fire away.
Perfect. That was great. Great presentation. Thanks, Spencer. Did Allan or James want to say anything before we open up for questions? Or yeah, good. Okay, great. Thanks. Great. Okay, so we've got, we'll start off with Michelle for questions.
Great, thanks, Chair. And Spencer, Allan, James, thank you so much for being here and I guess giving the picture because it wasn't one that I was familiar with. So I appreciate you bringing forward the information and presenting it so clearly and articulate for us. Before I had a question on the report that you had just mentioned, the underwrite report that you weren't able to get access to. Was that through a FOIP request that you tried to get access to?
Yes, it is.
Okay. Chair, I'd like to put forward a motion.
Sure.
I would like to put forward a motion to say that the committee write to the city requesting a copy of this report.
Okay, so there's a motion on the floor. This for committee members. Clerk, did you get the motion?
Yes. Can I just have the name of the report again?
It would be an underwriter's fire department survey.
Okay, is there any debate at this time, committee members, on that? No. Court?
So we're just asking for the report, is that?
Yeah.
Writing to the city to ask for the report.
Yeah. Okay, so all in favor, say aye.
Aye.
Aye. The motion passed unanimously. We're sending that letter to the city immediately, thanks. Go ahead, Michelle.
Great, thank you. So I guess I have a lot of different areas that I'd like to ask questions. So first of all, under mental health supports for your volunteers and for career firefighters, what supports are available and do you think that they are enough?
We have a couple programs within our department that members receive when they do come on the job. It helps you with resiliency, so prepares you for what you might see and deal with. It is a great program. It was done in conjunction with, in partnership, Vancouver Fire Department along with Canadian Mental Health Association, and they did a really great job of it. Both Allan and I are facilitators of that program, and it's been great. Also, within our own union, we have what's called a peer support program, and we have offered that to volunteers as well. Anybody that wants to take advantage of it, we've offered it to our leadership to take the word to the entire force, and by all means take advantage of that program. And with help from the province, we now have PTSD included within the list at workers' comp. That was a big achievement. Fantastic. So, yeah, there is some programs there. The city of Charlottetown also offers employee assistance programs. So those two are available. And the province, you're well aware, has the PEI Helping Tree, and it has some great resources there where some of our members have been referred to.
Michelle.
Thank you for that. Appreciate it. And I'm just also interested in so fire plans. I mean, we see this new student building being built. That would be probably one of your tallest buildings that would be within. Is that within the downtown jurisdiction, or is that in Station 2's boundaries?
The university does fall under our responsibility of Station 1. It does.
Michelle.
And so when we build differently, that obviously will require different skill sets in order to be able to attend to those fires. And I even look at the building codes and that kind of thing when they change, and then how you train based on that, even if it's steel roofs or whatever it is, like solar panels on the roofs, and how you deal with that kind of stuff. Do you feel like there is enough fire plans? And what I mean by that is like evacuation plans, so that businesses and building owners put in efficient plans and do efficient drills and that kind of thing, so that at least that side, the evacuation side, there's some sort of normal process around that.
Yeah, so our members are amazing what they do. I would say that they, in that field as well, when you're talking about the inspection division and prevention, they can never have enough help. In conjunction with the city planning department, they would work with them in order to achieve evacuation plans, what suppression equipment is required, exits, doors, windows, that type of thing. All of that would go through a process, but I do know that they are overwhelmed. Like much of the province, we are seeing so much construction and development that it's hard to keep up.
Sure.
Thank you for that. So would it be, I guess what would be the ultimate plan? Like, I'm hearing to have 4 people on site at least the station 1, but would that be the ultimate for all 3 stations when they're on? Or would you be advocating for like something different at the other 2 stations?
Right. There is a guideline from the National Fire Protection Association, NFPA, which sets out the guidelines for all departments across the nation. And we have members of the IFF that sit on those boards to determine what the recommendation is for a community of what size, area, etc., and also what those areas are compromised of in regards to buildings and businesses. Right now, Charlottetown attempts to achieve what's called NFPA 1720. Well, 1720 is really for a volunteer fire department, and they're reluctant to admit that we have what's called a composite department based on the percentage of career folks that we have. It's so small compared to our volunteer base. But what they neglect to mention is that 1720 really focuses on communities made of residences of 2,000 square feet. Well, that's majority of single dwelling homes would fall in that category. Whereas we refer to or aim for what's called a NFPA 1710, that expects you have so many personnel, so many pieces of equipment on scene within a certain time slot. There's not a lot of metrics, unfortunately, to the 1720, so it's a catch-all. It works for pretty well every fire department in PEI. They strive for that, and it's great because you need to be held accountable to something. But it's strictly a guideline, right? It's your municipality has the authority, having jurisdiction over which one they're going to follow, and are they going to attempt to reach that next level to make the city a safer place to live and visit. So in 1710, it really encompasses the city of Charlottetown because it looks at structures that are bigger than the 2,000 square feet. This building is not going to fall within that category. Go out to a rural community, the majority of the structures within those areas are going to fall within that. Yes, we're going to have our rinks and schools. That's all accounted for. So just to clarify again, does that answer the question?
Yeah, and I mean, so, Councillor Chair.
Sure. Go, Michelle.
And I guess also a big contributing factor to this is the amalgamation has increased the number of the population of Charlottetown by so much, right?
Right.
And I guess when you look at other cities, are there career firefighters in Summerside or any other municipality?
In Summerside, there's one gentleman. He falls under cleaner, and dispatcher.
Right, you said that. Okay.
But yes, just to expand on the earlier question, if I can, Chair.
Sure. Yes,
You're
please.
like the ultimate goal. So I'm talking about the guidelines. So that the city is kind of picking at the low hanging fruit. They're aiming for this 1720, we'll call it. It's just there's very little metrics to it. But what we'd like to see, if we even take those guidelines out, is a safe response for all members of our community. So that when we attend a fire, there's at least one truck going with career personnel on it. And trust me, those career personnel are anxiously waiting for the volunteers to come. One, they're going to be gassed. Two, they know that they're going to need their help. And we can only sustain what we're doing probably for 10 or 15 minutes. So when you say, talk about every station, in an ideal world, you should have 16 firefighters career at each station. There's stepping stones to get there with our current structure. Maybe adding additional staff at one station and having that one unit fully staffed to go citywide until the rest of the stations catch up. And when I say catch up, whether it be get there to help, or I mean the municipality itself, catch up with the times and come up to the levels where those other comparable cities that I discussed. We're known within the IFF organization as not being a fire department to model from. And that's really unfortunate because we're so proud, and it kind of knocks us down to think that our counterparts, I don't want to say they look down on us because all they want to do is bring us up, right? But it wouldn't be one of the top fire departments, and you would think being a capital city that, you know, even municipalities of similar size throughout Canada would look up to us. Most, if not all, are ahead of us in so many ways. You know, we only have so much time today, and I think this is the one that resonates the most with most people is staffing and service levels.
Great. Carla?
Thank you, Chair, and thank you so much for this presentation. When I was looking at the how do we compare slide, I thought, you know, your whole presentation could just be summed up by that one thing, because the emotion that evokes when you look at those numbers, it's shocking and scary and actually embarrassing, because it shows a lack of priority that our fire departments have on the island, and that's not okay. So I have a few questions that are going to kind of jump around, and some of them, Spencer, are based on conversations that we had before that I found really interesting and really kind of changed my perspective a bit on the importance of this, and kind of made me think of things I hadn't considered before. And one of those was around just how volunteerism has changed significantly, and the culture of the fire department in terms of volunteers, how that's changed so much, and how, you know, before people would be hanging out at the fire department, a call would come in and everyone would go out together, and safety in numbers right there. So can you explain to us a little bit how you've noticed volunteerism change over the last little while?
Sure. And just to be open, unfortunately, we don't represent the volunteers, but because we work so closely and we've done that job, we feel very comfortable talking about the topic. But from our point of view, and we've talked about it many times, is at one time the fire department was a clubhouse. You're right, you know, it was a place to drop in, a center of the community, similar to a rec center, you know, and it was great. You've seen families come in and you know, firefighters come in with their children and get them in the trucks on the weekends and that type of thing. But it's definitely turned into a business, and I'm not saying it's wrong. You know, there's parts of it. It is serious business. So, you know, it can't necessarily be the clubhouse it once was. Things have changed. What we see with volunteerism now is you used to have volunteers more readily available. Retention is very hard now, which puts an emphasis on why the need for career firefighters. At one time, maybe some of our firefighters weren't great to go home right after work. They were more inclined to come to the fire hall after work for a couple hours before they reported home to supper when supper was over and kids were already in bed. Now firefighters are being more respectful in their home life. They're going home, they're helping with what needs to be done at home, taking your kids where they need to go in the evenings to sporting events and stuff like that, not just one person in the home doing it all by themselves. So, and more people are career-oriented. You know, it is tough to get up and leave your employer and go to a fire all the time. It would be difficult for any of us right now in this setting to get up and leave. It's the same for anybody in an office space, or if you're in the field like I already mentioned, or in a boat or what have you. It's just not that easy. So what happens in Charlottetown is that you don't have guaranteed numbers coming. The only ones guaranteed to come are your career firefighters. So your numbers do change, it does fluctuate, and there's a lot of responsibility on a volunteer too. Obviously the risk that comes with becoming a firefighter, but you have to keep up your training, there's meetings, and outside of, maybe you're on committees that are part of those old club activities that still happen in some of those fire halls. So there's just so much responsibility, and we're just seeing volunteer decline and a lot of churn, and retention's tough.
Just to let everybody know, we're going to try to wrap up in about 20 minutes, so we're going to try to keep things moving along. And I know that you guys are very busy, and so that's our goal as a group. So, Carla?
All right, I'll try to keep these. So kind of along the lines of the volunteer, do you notice, kind of jumping off Michelle's question a little bit, but and kind of getting back to what you had said about the what was it, two by two? Two in, two out.
That's a minimum standard.
And so you show up at a fire by yourself, whether, you know, paid or volunteer, whatever, and you're not allowed to do anything until someone else gets there. So I can imagine the stress and anxiety that comes from when you get that call or waiting for that call, knowing that you have to sit there for however long and not do anything. And so I'm wondering, do you ever, and this might be more anecdotal and maybe you're not sure, but do you find that you would lose volunteers because of that? Would that play a part?
I'm not sure. I know that a lot of our volunteers have been impacted because they might be the first arriving volunteer, and it does happen, right? Not often in Charlottetown would a volunteer arrive before a career member, because of all the reasons we've already discussed, but it does happen. Or another example would be where you have a career member attending alone, and then they're the first incoming volunteer after them. They're still experiencing the same tragic events and trauma that original firefighter is, because now that second individual is trying to deal with the situation at hand, the firefighter that might be ramped up, and everybody's trying to collect their thoughts as a team. So I don't, that doesn't really answer your question, I know, but I don't know, I can't say for sure that it impacts retention.
Okay.
Just one more question, and just to that, I can imagine that that's stressful, and just to put that out there. And my last question I'll ask right now. So when you mentioned the third station is being designed right now, kind of a two-part question. Were you a part of deciding, yes, a third station is a good idea, let's do that? That's kind of the first part. But the second part would be, from what you've said, I'm wondering if you would be happier to press pause on the third station and work on the issues we have with the two stations. Did I hear that?
I think you hit the nail on the head. I think before starting something new, I think there's a lot of cleanup to be done first. I'm not denying we need a third station. In fact, if I recall correctly, in those reports that I talk about, done by the underwriters, there's been additional stations mentioned in those. So I can't neglect that. I do believe that we need a third station because our city is growing to the northwest. So there does need to be something there. So I don't think that we need to necessarily pause it forever, but maybe for a little while until we get things caught up, and maybe there's a better way to respond, change our fire service delivery within our current model by maybe collecting a few more resources outside of our equipment. And I should add, our equipment, standalone. It is amazing equipment. We've been provided with so much to do our job right, you know, and that's one thing that we're so proud of, is that when we do get there, we do have the tools necessary to get the job done. It's just to get there properly and have the folks on deck.
Thank you. Zach?
Thank you, Chair. Thanks again for coming in today. Just two things, kind of touching on what Carla had talked about. I know you don't represent the volunteers, but you did say you work quite closely with them. Are the volunteers basically asking for these same resource allocations, essentially more personnel?
I would say that you would see a split amongst volunteers. You know, I think volunteers have approached me and have encouraged our union to focus on what we're doing here today and lobby the folks that can help us out in order to get more career folks, to take some of the pressure off them. Now, to say that every volunteer feels that way, that definitely not. I'm sure folks find that maybe it's a bit threatening. But I've said it before and I'll say it again. The more volunteers that we have, it makes our job so much easier. So by no way do we ever want to replace that volunteer base. We simply want to be a service that assists in the entire outcome, because we are one department, we are one group, and we work as a team. So all it is another tool in our toolbox, and to fall within the necessary guidelines that we should already been doing 20, 30, 40 years ago.
Zach?
Okay, thank you. The other quick question is, the slide that I noticed the most was when you had the different communities up and the number of career personnel. I don't know if you know this off the top of your head, though. What would the number of stations be, just an approximate, in some of those cities that would be closer to the size of Charlottetown? How many stations would they have? I remember you mentioned Fredericton and Ormocto. How many stations?
Fredericton, because it's at the high scale, there are probably more than half a dozen stations. Correct me if I'm wrong, guys. However, like the closest comparables, without looking there, would be Truro. They have one. Miramichi, they would have two. Riverview has one. Ormocto too. Did I say that? So it ranges anywhere from 1 to 2 with our closest comparators. And then once you exceed, once you get up over 50,000 people in a community, then you start seeing an expansion of fire stations.
Zach?
No, I think that's it. Carla had touched on the last part, because you talked specifically about, the third station, maybe getting the other stations in. Because again, maybe as a resident, you drive by and you see this fire station, and especially where you mentioned there's the growth in the northwest part of the city. As a resident, they might be more reassured seeing the actual brick and mortar, as opposed to actually having the personnel to deliver the service.
I think that's really important to state, and a lot of folks assume that live in those new communities of Charlottetown. They're not so new anymore, but a lot of those people assume that they're protected in the same way. Drive by the station, exactly that. There's personnel there. When I call, they're going to be there. Yeah, they are, but it's just going to take them a little bit longer.
Zach? Corey? Yeah, good.
Thank you, Chair, and thank you, Spencer, and to everyone for coming in today for the presentation. I think Carol and Zach touched on a few of my questions, but the slide, I think, as Carla said, was kind of telling, was probably summed up the whole presentation quite well. I'm just curious, have you spoke to the Department of Justice and Public Safety about your concerns? And I guess I'm wondering, what response have you gotten from them? Has it just been simply, well, it's not our problem, to talk to the municipality?
To answer you, yes. We've spoke to Mr. Thompson, and we spoke to the Director of Public Safety, and we've also spoke with the Deputy Minister, and previously we spoke to Mr. Brown prior to the government change. So yeah, we've been in the system.
Corey?
And like you said, it's just simply usually been, well, sorry, we can't help you. We, yeah,
Yeah.
which is kind of concerning considering the fact that we have our largest hospital within the city, numerous schools, a number of large workplaces, events, whatnot. Does the hospital fall outside of, which zone is the hospital? And you said there was a couple of zones, so there's one
They're
zone.
attended to by volunteers only.
So our main hospital on PEI would have a, 5-minute response time approximately before, I guess, can you explain that?
Sure. So if we're talking specifically about the hospital, now, the approximate, and this is an average, you may have people at Station 2 that would respond to the hospital. They may be sitting there, it may be a Saturday afternoon, and volunteers do have a duty crew that is present there. They're checking their trucks, they're doing the things on the weekends and whatever. In a perfect condition, you might have them at the door of the hospital in 5 minutes. But on a work day in these time frames where we're ready and able to go, really, if you look at St. Peter's Road and Kent Street, I would say that us at Kent Street being ready all the time would get to the hospital every time first, and it's not a race, but it is a race if you're in the hospital and you're in trouble, right? You got your eyes peeled, you're waiting for us. We see them when we're helping people. Those folks are pretty desperate. Not necessarily saying the hospital, any cause.
Court?
Which I guess is kind of my concern, is that, we just kind of, that's not our problem, talk to the municipality. However, the government has buildings and services that we provide that's inside the municipality that you would think we would want certain standards met. And I guess the hospital kind of sticks out, but I'm sure there's lots of other examples, schools and stuff too. And that would be the same in rural PEI as well. To kind of just think that the department would say, well, sorry, we can't help. I guess it's just too bad that such response times would be too long, or lives might be put at risk. Because I know we do, through the MGA, the Municipal Government Act, we put requirements on communities to have certain, to offer certain services just to be considered a municipality. So you would think that perhaps fire services could be one of those, parts that we say that, okay, well, we have to have this standard of service in order to be a municipality. And I think that's not just Charlottetown, but any municipality. Like I represent most of Three Rivers falls within my area, the newly amalgamated area, and I think we're the 4th or 5th largest municipality now in PEI, and it's strictly just volunteer, which would be similar for I guess Cornwall and those other places. But I know, and I can't speak for them. They haven't told me. I haven't spoken to them whether or not they'd want paid firefighters, but I'm assuming they wouldn't say no to that. But the response times for them, and I know the calls they get are a lot of medical calls, first response, because ambulances simply just can't get there in time. But anyways, I kind of, that the department would say, well, no, it's not our problem, talk to the municipality. I don't really know if that doesn't seem right to me, doesn't sit right with me, that, especially when you look at some of the buildings that we have in here. But that was just kind of my thoughts on that.
Do you have the numbers for the latest fire that was on Capitol Drive at the hotel recently? How long was the response time for that?
I'm sorry, I do not have that with me.
No. Would that be from Station 2?
Yes.
Yeah.
Both stations were involved, though. When you have a fire of that magnitude, it's not uncommon for one station to call the other, whether it be to even go to the station it's most occupied. If their vehicles and personnel are already tied up in one call, the other station covers the other. And that's a great system, no different than we would do for any rural community. They if we're called, we go.
Mm-hmm. Now, the reason why I ask is that representing the western part of Charlottetown, when you talk about Station 1, Station 2, where the locations of the centers are, one of the areas of Charlottetown that gets most effective with time would be the western part of Charlottetown. Would you agree with that section is a very difficult area to get to from where the stations are for timing?
Yes and no, and I think that's, that's one benefit to having Station 3. The problem is with Station 3 is, back to what Zach said, is that it's great that it's there, and it might be the closest, and it may be the easiest to get to whoever's home, whether it be yours or whoever, from that station, but it doesn't mean much when there's nobody already sitting there ready to roll. So I think regardless of what happens at that station, Station 1 with its career staff is going to get to any part of your area faster than any other. And where you are it is a little bit cut up. You have your 2 districts in one.
Yeah, we've talked about that too. August 6, 2020 CBC article. Looking at that article, it talked about the status of your negotiations with your contract. Where are those negotiations, and how are they going with the city?
Unfortunately, because of rules around regulations and the labor board, we wouldn't be able to discuss the negotiations, the progress, or anything that's inside there. The majority of anything that we can talk about here in this forum would be strictly safety, and we don't believe that our safety needs to be negotiated on that topic.
Okay. Yeah. The 4.5 million that was allocated for the 3rd station. I mean, it's a crazy time now for construction. Was that? And you said it was a little bit it's a little bit backwards now how that funding was being allocated. Are they talking about 2022 opening for that station, or is that still the works? Or
That number was that next year was discussed, but I'm assuming that's probably delayed at this point with no ground broke yet. And 4.5 million today might do the concrete, and it might do the steel structure, but it's just I don't know what kind of station you can get, unless it's built in a phase format, small station today, but it may grow into a larger station in the future. It's just if you talk to any developer or project manager, it's pretty safe to say that you would normally identify the needs, get the input, and I think, Carla, you might ask me about the input we've had towards those things. We have a body from our association that sits on a team that was supposed to help develop, plan, and design this station, and we haven't been included yet. So, sorry to go back to that, but as for Station 3, we have not had any input whatsoever thus far. And we, like I said, we have a lot to offer with the background of our parent union and station design, and unfortunately we haven't been able to contribute anything.
Yeah, the numbers that you had on there in comparisons were pretty staggering. If this committee was able to go, and Corey kind of touched on this a little bit, if this committee was to go back to the Minister of Justice and public safety is the key.
That's right.
I think. What would you have us say to him as a committee of MLAs? What would you want us to relay to him?
Well, I said it, that I believe all Islanders, and especially those of us that are in this room, in a public position and servants to the community, I believe that we have a responsibility to correct what's currently happening and provide whatever resources are required to keep the citizens, tourists, business, and everybody safe in this community. As it stands today, when we weigh ourselves against other communities of this size, we can easily see that we're well behind the times, in a staggering way too. When I talk to some of these comparables that are on there, they haven't been working like this just in recent years. It's always been that way for as long as most of those folks can remember.
Okay. I think Michelle's got maybe a couple of questions, and then we'll. Good, Michelle.
Thanks, just a couple more. So the fire marshal's office, that is serviced out of the Department of Environment, that's correct? And so my understanding is there has been communication, or there was communication with that department when Minister Jameson was the minister, is that correct? Like, did you have discussions with them as well?
I have spoke to Minister Jameson, very similar conversations as we're having today, but you're talking about our Office of Fire Marshal's office. They actually would fall under Justice and Public Safety.
Okay.
Michelle.
Okay, thank you. I just have a FOIP response here, and it was communications, and I know you don't have it in front of you, but anyway, it was coming out of that office, so I'm not sure if that would, why that was the case. So, but just to...
I'm going to be able to clarify that, sorry.
Yeah, okay.
When I spoke to Minister Jameson,
Yeah.
she would have been the MLA responsible for the city, Charlottetown, so that might have been the tie there.
Okay, thank you.
Michelle?
And thanks, I'm trying to go quick, I know you're trying to. Conflict resolution would fall, for labor, would fall under the Department of Economic Growth, Tourism and Culture. Was there discussion there as well around any labor discussions, I guess, between the city and the Department of Economic Growth? Just from a labor perspective.
I believe that the PEI Federation of Labor has expressed our concerns to somebody, but I can't confirm to who and what department, or I forget. It might have been Minister McKay at the time.
Michelle.
Final question. In response to my last, like before we moved around, I had asked about the plan and what would be, what would be the gold standard kind of idea, and you had said you have to grow to that, right? Like there's steps that you can take in order to get that. Has there been a plan developed, like a strategic plan developed that has been presented to the city of suggestions as to how you feel that the department could get there?
Yes. The third-party reviews do indicate what the recommendations are, and there is some literature in there and the implementation of those.
Great, thank you very much.
James, Allan, and Spencer, on behalf of the committee, I'd just like to thank you. What you did today was important, and we'll be doing some work. We're going to include this in our report to the standing committee or to the legislative assembly, and potentially maybe doing some more work on this. But you did your community justice today, so thank you very much for coming in.
About the Cotton
Absolutely.
Drive hotel call there?
Absolutely.
It's actually some of our members, career and volunteer, are watching us right now on
Yeah.
live stream. And they're texting me. They said it was a 9-minute response time from the time of the call to arriving on scene.
Okay.
It's 9 minutes, and that's with the city police arriving on scene and confirming that there is an active fire in the hotel.
Okay. Great. Again, thank you very much, and thanks for everybody watching and all the volunteer firefighters out there doing justice for the city and everybody keeping us safe. So we'll take a short recess. Our guests are welcome to go out and we'll just finish up our business and maybe join you. Great. We're back. Just to move on to new business, but it'll be / scheduling on there. So just bringing up with the committee that June 16th, a week from today, we're going to be moving that time with Dr. Garnham to 10 a.m. 10 a.m. Next week. So if the members can add that into their schedules. And saying that with committees changing and such, this committee there's a potential that the committee might be able to move to the mornings into the summer and into the fall. I just want to get a sense of from the members what you would think of that time change potentially. Okay, good. So
What time in the morning?
7 a.m.
Then I'm not so keen on that one. As the one, Corey and I have been the two that travel the farthest there.
yeah.
So you're talking mostly 9:30, 10-ish or something?
Yeah, we wouldn't start a meeting before 9:30. I think we could shoot for 9:30, or
I have no problem with that. I guess
Yeah.
there's just knowing that clarification. That's
Sure.
AM is a long.
10. Perfect. Okay. So we'll unless we have if we have multiple guests, that would be the only time we would try to maybe go at 9:30. Clerk.
And I believe some weeks Legislative Management Committee does use that morning, so we might be juggling a little bit with them. And then also for the meetings that have already been arranged for 1:30, if the committee's okay with keeping those times. But going forward, I can try for
Yeah.
mornings.
Mr. Henderson.
Chair, there's just, I guess I was bringing up, I think our committee received a letter from the Native Council of PEI just to acknowledge, I guess, that we've received that letter, but also my intentions were not to say that they couldn't come to present, but if they want to go through whatever processes to present on behalf of their membership of PEI to this committee, I'm okay with any of that.
Absolutely. Okay, great. Yeah, and we would love to see them. Clerk. No. Okay. Yeah. Thank you for that. So that correspondence was received.
I have received correspondence now, so if the minute or the member.
Well, there was an email sent, I don't know who all it was
Yeah.
sent to. You received?
Yeah, I received
I think
it
was
too. I'll
received
forward
sent
it.
to the chair, actually.
I'll forward it to the clerk for sure.
First.
It just came in very recently, so yeah, we'll send it to the members. Yeah, great. Is there any other new business at this time? Michelle?
Yeah, and just on that, I don't know if we actually discussed who, after we bring in the department, executive council, to talk to where they are with the TRC, Truth and Reconciliation, because I don't think we actually talked about who we would put a request out, but I think that it's fair to invite any of the representation from the Indigenous communities to come and speak to us, I think, but we haven't actually discussed that as the first step, I think. Yeah, the first step, we said, let's bring in the executive council. Then we have a follow-up step from there to ensure that
Sure.
those that would like to come, and I think that anybody that would like to come should have that
Yeah.
opportunity.
Yeah.
So I think the invitation would then, so I'll put forward a motion that the invitation goes out to any of the Indigenous communities that would like to present to us, but after we meet with executive council.
Great. Mr. Henderson?
Just to add into that, there are certain protocols, which is, I guess, was what I was bringing up at the time, was that on the subject, there was either a protocol, I wasn't sure whether it was to go through Les Nuits or through Mi'kmaq Confederacy to determine who they felt was appropriate. Like I say, I in no means was trying to dismiss the role that the Native Council of PEI plays, but I also want to say that we don't want to break this wide. I mean, there's many different groups that can be out there and represent, so I just think we want to follow whatever the proper protocols are for the groups that are, and then decide if we want to, how far you want to expand this, because like I say, I just find there's so many groups out there, and we could be sitting here forever on groups, and that's not maybe the intention of trying to deal with the issue of the role that residential schools played and what role the churches and government played in that. So I think Michelle's points are very appropriate. We did not sit down as a group and decide which groups come to here, and for whatever reasons, words get interpreted and letters start coming. But I think it is important that we look at the Aboriginal or Indigenous Secretariat through the Premier's office And then we start to branch out from there and find, like say, what are the proper protocols to identify what are the proper groups and decide from there. And like I say, then as a committee, if we feel that we haven't addressed all of the issues and needs out there, or all the groups haven't been heard, then we can add in from there. But it's just complex to who represents who in all of these different
Yeah.
groups, is what I'm trying to say.
Sure, excellent. Thank you for those comments. Clerk?
Just from a scheduling point of view, would the committee be open to offering a written submission or presentation, whichever the groups would prefer, and I can work with them to organize that?
Sure. Yeah, absolutely. Just make sure, I appreciate the comments for sure, and we want to make sure we include, we have to hear from Islanders, and we have to follow the proper protocols of the committee. So that's all we were doing, and then again, last week, if you were just tuning in, we had a lot of different subjects. That was a main one that the committee decided to do, and rightfully so, and everybody, we always want to definitely include everybody and get a good sense of how this is all affecting Prince Edward Island. So there's a motion on the floor. Do you have the motion?
Yes, an invitation go out to any of the Indigenous communities after we meet with Executive Council.
Yeah. So motion, all in favor? Motion? Aye. Okay, so the motion passes, so we'll do that. Any other new business, Michelle?
Thanks, Chair. So last week when we were discussing, talking about health and PCH and the situation with staffing and shortages, we all agreed that we would meet with Dr. Gardam. I would also like to put out to the committee that we call the Health PEI Board to come in. They're part of the governance structure. So Dr. Gardam would be the CEO of Health PEI, but the board is actually one level up, responsible for the end-to-end. So I would put forward a motion that we ask them to come in to present to us as well.
Okay, so that motion is on the floor. Any discussion about bringing the Health PEI Board into the committee?
Just a question, Michelle. What are they coming in to present on or speak on, sorry?
Well, it's the board structure, so the CEO actually reports into the board. So the board would be setting the direction, and if we have a crisis in our healthcare system, the board absolutely would be part of working through those situations, and it's the governance of Health PEI. They provide oversight, accountability of what's actually happening within the system.
But are we talking about more specifically with PCH? So with the...
Well, I mean, Dr. Gardam would be the operational piece, right? The board would be the oversight and how it's operating, and if it's operating with due process and the way that it's supposed to be.
So then,
Go ahead.
getting the board in, then do we need to have Dr. Gardam present as well?
I
Michelle,
think
yeah.
Dr. Gardam absolutely, because he's the CEO of Health PEI, and that's the operational piece of it. He's been very engaged, and that's like I'd say the boots on the ground of what's actually happening, and then the board is how they holding the operational piece accountable to ensure that they are functioning the way that that's been set out by the department. So I think it's beneficial to have both of them.
Okay. Rob?
From my perspective, I don't oppose Health PEI or the board coming in and ever, but I guess where I was kind of coming back to was that our original thoughts were to try to develop a work plan. The work plan was, to get down to the matter of what's going on at the Prince County Hospital and surgeries being diverted, recruiting and retention seemed to be all the issues when we kind of identified our top four. I guess I don't necessarily see the direct link with the Health PEI and governance to the Prince County Hospital specifically, because they're probably not directly associated, where the COO or the CEO directly is. So I guess all I'm saying, I don't oppose them coming in. I just would wonder how many meetings are we going to have, and I would like to focus on our top priorities that we had identified as a committee first, and then look at going beyond that when time permits. And so I guess that's ultimately my comment on it. I don't oppose health PEI coming in or anything like that, but I want to get to the meat of the matter with what's going on in Prince County. Dr. Garden would be part of that. I want to get to the focus on our nurses' unions and the issues around recruiting and retention of health professionals. That was, I think, one of our other priorities. And the third was the issue around our Indigenous people and the roles that we can play as a province in the Indigenous schools. So I don't directly see health PEI board structure and the governance and how that impacts on those three directly. It does by all means as my top three. But if the committee wishes, I'm not opposing it. So I just thought I'd add my 2 cents worth in.
Thank you. Corey?
Michelle, did you want the board, like the whole board, or just like the chair?
Just the chair.
To come, like with Dr. Carter?
I think it should be the chair and and it's similar to when we had the Liquor Commission come in for PAC, right? Like we had the CEO, we had the board come in to speak to the entire picture. And I know one of the recommendations that was put forward, or one of the wants of the Premier, was to increase the surgeons from 3 to 4. And that's a board decision, right? Like that's something that has to go through the board. So if we're going to actually talk about how we're going to fix problems in healthcare, the board needs to be part of that solution. And again, so does Dr. Gardam, as that's the operational piece of it. But it's that complete end-to-end. I mean, we talked about that a lot in the legislature when we were working on the piece of legislation. If you're making changes within the health system, how does that impact at the end-to-end? And the board is responsible for holding accountability. So I'm fine if they come in at the same time, or if they come in at a different time. And they were in the media recently about discussing how to achieve what the new ask of the Premier was. But I think it's important that the board is a part of that accountability and governance process.
Corey?
It's a long-winded answer.
No, I agree. I wasn't sure if you wanted them in at the same time next week, because I was thinking, is Derek Key he's the chair, right? And he's he's another job. He might not be able to come in that short a notice, but just an idea, maybe we have after next week, if we still feel that it would be beneficial to have Mr. Key, and then the committee to decide at the time if we feel that our answers or questions haven't been quite answered, or that we still have a lot more questions around it than we do have Mr. Key. And I'm not, like I said, as Rob, I'm not opposed to it. I'm just, maybe we just wait to see how next week goes.
So there's a motion on the floor about this. So the motion would be, I guess we'd need a specific ask. We're bringing the board in to talk about one of our main goals, which is the PCH and not the governance structure of the board. Would that be, I'm just looking for clarification. Would that be about, yeah. So that, can you read the motion that you potentially have right now?
I just have a motion to call. I added in the chair of the Health PEI board regarding PCH or challenges of PCH.
Would that, yeah, Corey?
Michelle, I'm not sure, are you willing to withdraw your motion and we can discuss it next week I'm not trying to not have him in, I'm just.
Right. I almost feel like we're circumventing the board, though, to be honest. Like, the governance structure is, the board, and then the CEO reports into the board. So, I mean, right.
Michelle, you have the floor?
And Robbie just said, so we should have had the board first, and I did. I wrote to the chair earlier this week, recognizing that we did not ask in that meeting to have the board called, and we agreed that I would put it forward as a motion in this meeting. But I do think that out of respect for the board, that we should put an invitation out and ask them to come in and speak to the committee.
Any other discussions there before we vote on this? So the motion will stand. Corey?
I'll support the motion. I'm fine if we
Okay.
want, if the committee wants to have them in. I'm just, I guess we're not gonna say, well, you need to come in next Wednesday, right? It's just whenever they can.
No. Okay, perfect. So all in favor of the motion?
Aye.
Okay, motion passes. So thanks a lot for bringing those up. Any other new business? No? Can I get a motion to adjourn? Okay, Carla? This meeting is adjourned. Thank you.